Hello. It seems not so long ago that we were wrapping up 2011 and planning for 2012. I'm so proud of what we've accomplished together, delivering on our promise to do whatever it takes to help all children grow up healthy and achieve their full potential. What better place to start today than here at the Nemours Alfred I. DuPont Hospital for Children, where our story began more than 70 years ago. Continues to unfold with our Delaware expansion set to open in August of 2014. Our successes in 2012 were many. I'd like to take a few moments to highlight some of your great work. Congratulations to the Nemours Alfred I. DuPont Hospital for Children on earning Magnet designation from the American Nurses Credentialing Center.
AI DuPont Hospital for Children is a Magnet credential organization.
We've known that our nurses have always been special, and now everyone knows. I know that you share my great pride in Nemours' recognition by U.S. News & World Report as a top children's hospital for the third year in a row. Nemours also received more than $25 million in non-NIH U.S. government grants, recognizing our successful change in research strategy by employing cross-functional expertise and the advanced electronic environment that has already earned us top honors. Our accomplishment of being named a Leapfrog Group Top 12 Children's Hospital is just outstanding. But what's even more remarkable is how we got there. We became a Leapfrog Group Top 12 hospital, not because recognition was our goal, but because we very intentionally said that quality and safety are what we do. It's what our families expect, and it's the kind of care we want to provide our patients and families. So we put in place a multi-dimensional strategy to achieve our goal. But strategies don't mean a thing without people. Let's look at safety and quality. Every clinical division, and we have more than 90 at Nemours, began developing metrics for quality. We changed our risk management structure. We set the bar on safety very high. 100% compliance with national patient safety goals for children, 100% of the time. These very intentional strategies are how we deliver the highest quality, safest care that results in outstanding outcomes. Take central line infections, for example. At AI, we haven't had one in 2 years. This is a direct result of the meticulous attention and personal commitment to excellence on the part of our physicians, nurses, and staff. This has increased patient satisfaction and reduced hospital stays. Because of you, we're reaching really top-tier quality. We had a near flawless opening of our second children's hospital in Orlando, beyond even our own high expectations, as we became the only health system in the nation with 2 dedicated freestanding children's hospitals. Few people realize the dramatic accomplishments in passing Florida's Agency for Healthcare Administration and the Joint Commission surveys without provisionals. These are amazing accomplishments that I attribute to replicating our strategy for delivering quality and safety.
Welcome, good morning.
Nemours Children's Hospital has fantastic people and has a wonderful future-forward building. But it would never have opened successfully without the tremendous help from associates all across the system. It's a dramatic example of the power of One Nemours. On behalf of our board of directors, senior management, and all of our stakeholders, I thank you for a job incredibly well done. All of our 2012 accomplishments demonstrate the power of leveraging our entire system to improve the health of our communities. For example, we have great outcomes in cystic fibrosis in Jacksonville, yet another achievement of which we can be proud.
Then big, 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 bust it harder, harder. Don't stop, catch that toast. There we go, good job.
But the true impact comes when we implement the practices that yield these successful outcomes at every Nemours site. Our research strategy, begun 3 years ago, is another great example of forward thinking and teamwork. This effort has produced fantastic results, which include not only significant research outcomes, but also a significant increase in external funding. Another success is Kids Health and how it crosses every venue: education, research, and caring for kids, both at Nemours and at home. Kids Health led the effort to improve discharge instructions, an area identified by families and associates for improvement. Collaborating with clinical practice associates, they brought the full power of One Nemours to the task. These outstanding accomplishments are a natural result of our intentional approach to improve quality and safety and better integrate translational research to improve outcomes. As we collaborate across Nemours, we become more than one hospital, one clinic, or one care team. We are hope for the future to the families who entrust their children to our care.
Remember 28.8? Yeah.
Another aspect is preparing Nemours to be successful in whatever healthcare environment the future brings. We expect more and more that reimbursement will depend on our families' satisfaction and the outcomes achieved. I'm confident that our work to this point has put Nemours in a very good place to compete going forward. We're getting better and better at watching our margins, generating additional revenue, and preserving the trust in perpetuity. This is essential to our mission and promise to care for children forever. So bottom line, if we wanted to expand at AI, we had to pay for it ourselves, and that's what we did. By the time it opens, we will have completely paid for our fabulous Delaware expansion tower. This accomplishment is possible because of increased efficiencies across our entire system, allowing us to serve even more children. Our Nemours Children's Clinic in Jacksonville, for example, has had its budget trimmed by about 30% over the past 3 years. Yet, they're seeing more patients more quickly than ever before, and they're leaders in receiving innovative grants. They've improved their processes to become better than ever, with 30% less subsidy. That is remarkable. Pensacola continues to be an important part of our strategy, and we're focused on our opportunities there for growth, to provide more comprehensive care for more children in Florida's Panhandle. Our long-term vision in Florida is to establish the most trusted children's healthcare system in the region, one that encompasses the points of the triangle of Orlando, Jacksonville, and Pensacola. Preparing the organization for a dramatic change in the business model is behind the importance of the ICD-10 work and continuing to expand our electronic environment. Our electronic environment is also the foundation of our ability to pilot different models of care, like our efforts to dramatically improve asthma outcomes in Delaware, the costs of which are funded by a grant from the Centers for Medicare and Medicaid Innovation. Because it's a brave new world, and no organization can do it all, we aspire to foster new relationships with like-minded organizations, governments, and employers. The Children's Health Alliance, our innovative approach to creating a primary care network in Central Florida, is one example. In the Delaware Valley, our partnership with Bryn Mawr and the building of an ambulatory surgery center is another example. In Delaware, we're also piloting the medical home concept in 3 of our primary care clinics. This experience will provide us the basis for partnering with others in the community to address the needs of both healthy and chronically ill children that Nemours on its own can't fully meet. Healthcare is experiencing turbulent times, and it's not just Nemours feeling the pinch. But frankly, we're in better shape than most health systems because we have been thinking ahead, working together, and looking to the future. I encourage you to celebrate these successes and to remain focused on our strategy. Our outcomes are going to have to become even better. We're making great progress, but we can never be satisfied. And our costs have to come down. But you can't just cost cut your way to greatness. That's why continuous improvement is such an important part of our future. It means finding better and more efficient ways to do things, embracing approaches and practices to drive out waste and provide resources not only to keep us whole, but to honor our principles of providing the best care. Our continuous improvement project that illustrates these results beautifully is the pre-op process at AI. We had overcrowded waiting rooms and patients were overflowing into PACU. In fact, we budgeted more than $400,000 to create 5 additional pre-op holding bays. With continuous improvement 1 year later, we are using the space more effectively. We have implemented new processes in pre-op holding, and staff there lead huddles twice a day. And another great outcome, the $400,000 expansion is no longer necessary. But the best part is a dramatic improvement in the patient experience. Continuous improvement is so much more than a financial consideration. It's about getting better and better at what we do. I think it's the only way for us to become the organization we want to be and honor our charge to care for children in perpetuity. In closing, words are simply inadequate to fully convey the immense gratitude and respect I have for you. Thank you for enriching the lives of children and their families, the lives of your colleagues, and for your tremendous contributions to Nemours. I believe that Nemours is helping to create the future of healthcare for children rather than just reacting to changes. I absolutely have the sense that, wow, we can do anything.